Other modalities that you've brought into the center?
We've brought in Reiki.
Yes.
Okay, and a lot of people think of Reiki as this, what is it? This person places their hands on me.
Yeah.
And we don't, I feel good, I feel relaxed, but I'm not quite sure what happened.
So why did you bring Reiki? You could have brought a million things in.
Because I really believe that Reiki gets us in touch with ourselves.
Huh.
And that's what a lot of people don't. We're so used to having other people tell us what we need.
That is such a good reason.
That Reiki actually, and Terry, our Reiki master.
We're going to see some of Terry Kareen.
Is so good at getting people to go within.
Because that's where it's all happening.
It's all happening inside. It's it. You have to get to that same energy that Nuryef talked about is the same energy that we need to tap into.
Wow.
And that's what Reiki brings in.
Well, then let's go to Terry Kareen running a little bit of Reiki on yours truly. So you also, am I saying it right? You do Reiki on somebody?
I'm a Reiki practitioner, and I do Reiki. Yes,
okay, so where did you get that? Also a certification, if I'm not mistaken, or is there?
You're certified, yes. And you can have as many teachers as there are levels.
Wow.
You don't have to be, well, they're called attunements, and you are certified. At the end, you get a certificate, but there are attunements, and there's different levels. So I'm certified Karuna Reiki Master Teacher, which is the highest you can in the Usui method of Reiki.
Which is what you practice.
Which is what I practice.
And how long have you been practicing Reiki?
12 years.
12 years. How about here at this facility, at the Wellness Center?
The same amount of time, about 6 years.
6 years. That's
been
great.
Teaching it, yes, all levels here.
Well, I remember, I agree that Reiki has definitely is more acceptable within the medical community.
Yes.
I will never forget the day that I was going on rounds with the medical team at Akron City Hospital, and there was a woman doing Reiki on one of the patients in the intensive care unit. And I almost thought, okay, is someone going to get really upset? And the doctors, the residents were like so cool with it. I'm not saying that they thought, oh yes, now this person is going to be healed, but that's not what it's about anyway, is it?
No, it's not. Reiki means universal life force energy.
Ah.
So when we are depleted of life force energy because of illness or stress or disease, that helps to replenish the life force energy that
I was just asking, I was just talking about that with somebody, that we're giving and we're on sin. We're drained. Yes. That is a beautiful word.
Yes.
What are we doing in this culture to replenish ourselves? And this is one of the things.
And Cleveland Clinic has been using it at the main campus. They have Reiki practitioners that volunteer.
Oh my, the world-renowned Cleveland Clinic.
But now at Ahuja in University Hospital, the new one, they are tuning their nurses.
No.
Yes.
This is like a dream come true.
Yes, it is. It's for all of those of us that practice.
Give. Yes.
That practice all the complementary, I shouldn't say alternative, but complementary.
I like that word too.
Yeah. It's a big step for us.
That is a huge step.
It's very big. Well, Reiki basically works with the 7 energy centers of the body, or chakras.
Okay.
Okay.
We're kind of familiar with chakras now, I think, most people.
Most people are, yes, because of Reiki. And the fact that we use it, that the chakras are really, well, it works on the chakras.
Okay. Okay. So
there's 7 energy centers of the body, and what I do, I usually start with the head, with the crown chakra, and this relaxes actually the left and right brain.
So are you
I'm
putting
just
your
asking,
energy in me?
No,
okay.
No, the Reiki energy, I ask the Reiki energy to flow, and it flows out my hands.
So you're like a conduit.
I am. I'm a channel.
Okay.
I'm a channel for the Reiki energy.
Okay.
So and there are different positions that I use. You don't have to stay with those positions, but you move along, usually the chakras, the crown, and then you can move on to the 6th chakra, which is the intuition chakra.
Oh, I need that one. And this is all part of your training. They train you to be a conduit.
Yes, that's exactly. When you get an attunement, the master transfers the Reiki energy through themselves, herself, himself, to to the student.
Terry Kareen also does reflexology.
Yes, she does.
Why did you bring reflexology in?
Well,
or did it come with Terry?
It came with Terry.
It was a package.
It was a package deal. Actually, you know, reflexology, and I give a lot of this credit to my mother-in-law. God, may she rest in peace. But she was way, way ahead of herself, and she showed me this book. I've known my wife over 40 years now, about 40 years ago, and she says, this is where it's going to be. This is where medicine is going to go.
A book on reflexology?
Book on reflexology.
She was ahead of her time.
She was way ahead of her time. And I read it, and it, you know, it made sense.
But not everybody would read it and say, oh, this makes sense, especially then. So give yourself some credit there. Okay.
And I needed to keep it in with my mother-in-law.
Yeah.
You know.
Aha. Now we know.
Now we know. But reflexology is a great way, once again, of connecting the dots.
Got it.
Okay, because the nerves do end in the feet, and by accessing them, now is it going to bring about a miracle cure? No. What we're doing is we're trying to assist your body to create its own healing energy, to bring healing to you.
I love that. Let's take a look at my feet and Terry Kareen explaining and doing a little bit of reflexology. What is the philosophy behind reflexology?
Okay, the philosophy is there's reflexes in the feet for every gland, organ, and part of the body.
So everything's connected, which we talked about with Dennis.
And working those reflexes helps to improve nerve and blood supply. It promotes the unblocking of nerve impulses, and the main thing it does is relieve stress and tension.
Okay.
So it addresses stress, it addresses congestion, and it addresses congestion, and what's the other one I'm thinking of? I can't think of the other one.
So
Anyway,
basically the underlying causes or things that get stuck or blocked that end up manifesting later in disease.
Exactly.
So people aren't coming because they want a cure for their cancer, a cure for their lupus. I always want to make that point so people understand where we're coming from with this.
Right. Now, we don't treat for any particular condition, but it engulfs everything.
Okay.
And so what it does is it helps the body to obtain balance, which is what disease is.
Is it
it's a lack of
ultimately
balance in the body?
So allowing the body then to kind of take care of its. You're really helping the body take care of itself.
Actually, it helps to heal itself. Yeah.
Got it. Okay, so let's do a little demonstration.
Sure.
I get to use my feet again.
Yes.
Great. And so normally somebody would come in like this, and I'm going to lie back, correct?
Yes. Correct.
Okay. So this is your typical session, basically.
This is a typical session. So it starts out with a series of relaxation techniques.
Oh, that's always lovely.
Okay.
See, I would sign up just for that.
And it does. It relaxes the person right away if they're tense. And I can tell by the way their feet are moving how tense they are.
Oh, wow.
And the lack of movement,
wow.
so to speak.
Okay. And Dennis talks about that too. So there's definitely a connection there.
There's definitely a connection. So this is the spinal reflex that I'm working right now. It's called the spinal twist.
Okay.
And the spine itself has 31 pair of nerves that come off of it.
Wow.
And when we work the spinal reflex, we are actually opening up and promoting better circulation to the spine in its entirety. So it goes right from the beginning.
And so it's not something the patient feels. Like, I don't feel you working on my spine.
No.
Right, because it's something that's happening. Is it kind of happening deeply, like what you have here, the acupuncture, or is
yes. Well, it does, but you will. Clients do feel like energy surges.
Okay.
Up their leg, or they'll feel it in their back.
Okay.
So if there is an area that opens up, you know, the energy opens up.
They will feel that.
They will feel that. Yes.